Hi, I'm Dr. Chrissie. I'm one of the pediatricians here at Willamette Falls, and I am here to share with you a few of the things that I like to share with my newborn families. Congratulations on your newest arrival. I hope you find this information useful. First of all, I like to share that my favorite book to have around is called Baby 411. It's the closest we have to a user's guide, in my opinion. It's a paperback book. You can find it on your online retailers. I would go ahead and order that now if someone hasn't gifted it to you. It has a thumbable index on the side so you can get to the information you need quickly. It's reliable information and it gives a few different perspectives, so it's not all slanted information. I was surprised to find that even as a pediatrician, that book taught me things. And as a pro tip, there's also Toddler 411 for future use. Here are a few numbers that you're going to want to be familiar with. A temperature of concern is 100.4. 100.4. Now that's not much of a fever for you or me, but it is quite a fever for a newborn in the first 6 weeks of life. The reason that we take fevers very seriously in the first 6 weeks of life is that there's not a developed blood-brain barrier, so any infection in the baby's bloodstream can affect their neurological system quite quickly. So please keep that in mind. The best way to take a baby's temperature, the gold standard, is a rectal temperature. However, it is a little invasive, and so we often start with a axillary or under the armpit temperature, as you're probably familiar with. So if we use an under the armpit temperature, I add 1 degree to keep it very accurate. A lot of people are surprised to find out that babies lose weight after they're born. Not all babies, but many babies, and that is very normal. Another number here, 10%. So babies can lose up to 10% of their birth weight without worrying us too much. If they lose beyond the 10% mark, we begin to think it's time to get some plans in place to help them, okay? They have until 2 weeks of age to come back to their birth weight. So there are often many worries about, is my baby getting enough food? Is it a problem that they're losing weight? So I'm just here to say losing weight is normal, and getting milk in takes a few days. So if you're breastfeeding your baby, which I hope that you are for all of its many, many benefits to both baby and you, I would make sure that you are feeding the baby every 3 hours. And when I say every 3 hours, we're counting from the beginning of a feed. So if you feed the baby starting at 8 a.m., it doesn't matter if the baby fed for 10 minutes or 30 minutes, we're still going to start that next feed by 11 a.m. And if the baby isn't waking up to feed itself, then we will wake them up, mess with them, make them a little bit less comfy, maybe change their diaper, maybe take off a layer. Speaking of layers, a lot of parents wonder, how much should I bundle my baby? And I usually tell people just 1 layer more than you would feel comfortable in. What temperature should the rooms be at home? Around 68 to 72 degrees, something that's comfortable for you and me, and then baby needs 1 degree more. Okay? We start also thinking about numbers of wet diapers per day. So we want to see at least 1 void or urination, 1 wet diaper, and 1 stool or poop in the first 24 hours. If there are more, that's great, but we just want to see a minimum of 1, okay? And then we want to see the babies having sequentially more wet diapers with each passing day. When babies start to eat, their little tummies are about the size of a large walnut, so they're not taking in very much food, but very quickly they can take more food over the first few days of life, right? So 1 urine in the first 24 hours, and then as many urines as they are days old. So 1 urine on day 1, at least 2 on day 2, and so on up through the first week. After first week, we can have up to 8, 9 urinations a day. And that can be normal, okay? Sleep. Babies sleep a lot, especially during the first few days. And you may find that they have difficulty waking up at the breast and things like that. So don't worry, that is perfectly normal. All of the snuggling skin to skin, all of the oral exploration, this is all part of their learning how to breastfeed and also your learning. Here's a pro tip. If a latch is painful, go ahead and interrupt that latch. Don't be a hero. We can use our finger to unlatch the baby to avoid sort of the suction pain of taking baby off. That's important to know. And sometimes babies use moms as a pacifier. Don't be a hero. If that is painful for you, please take a rest. Additionally, speaking of pacifiers, Many places have concerns about nipple confusion and the use of pacifiers early. I personally feel like pacifiers are a very reasonable thing to offer babies. They have very few self-soothing options, and one of the options they do have is to use a pacifier to do non-nutritive sucking. Otherwise, they might use your breast as a pacifier, which can cause more damage to the nipple area and difficulties in that realm. As far as stools go, you'll notice that your baby's poops at the beginning are very dark and typically quite sticky, difficult to clean. Luckily, they don't stay that way. As the milk comes in and you're getting more milk instead of colostrum, those stools start to change color, and we see them turning from dark brown and blackish into yellow and green, and many different colors can be normal. You'll see little sesame seed shapes in there. Those are curds. We call that a seedy poop. It's very normal, very, very normal. Also, you will be asking yourself, is this normal? Quite often. Again, Baby 411 is a great resource for that. Or if you are going to go to the internet, healthychildren.org is the American Academy of Pediatrics website, and that's a great place to start. So we've talked about temperature, we've talked about weight loss, we've talked about feeding every 3 hours, we've talked about how much urine and stool to expect, and now we're going to talk a little bit about sleep safety. So all babies should sleep on their backs, not on their sides, not on their tummies, and this is to prevent sudden infant death syndrome. So we want to do everything we can to decrease those risks, including sleep safety. One of the things we can do is not smoke in the family. That is one of the most important things that is evidence-based to prevent sudden infant death syndrome. Other than that, we want babies to sleep in a bassinet or crib near your bed, but preferably not in your bed. So we like to have babies at first in your room so that you can hear them when they stir, when they need to feed during the night. They should be tightly swaddled or in a sleep sack with no loose blankets, no pillows, no toys, nothing additional in their sleep space. Sleeping safely also includes naps. They should also be in a safe sleep space for naps during the day. So please don't sleep with them on a couch or in a stuffed chair that's quite big. Big bodies and little bodies in those spaces do not mix safely. In addition, if you're ever at a friend or family member's house and they offer to you, oh, I'll put some pillows around the bed and the baby can sleep in the middle, that way they won't fall off, please know this is not a safe option. This is never, ever a safe option. What else can we do to keep our babies safe? Hand washing, hand hygiene, very important for keeping our babies safe. Make sure that all of your visitors and admirers come feeling well, not sick, and do lots of good hand hygiene. It's okay to ask them. You can blame it on the pediatrics team and say, you know, our doctor said please just be very careful about preventing infection for this baby. A word about siblings, especially toddler age siblings. They're going to be a little bit have their world rocked by having a new baby in the house. So if you have a toddler or an older sibling, please make sure that they're getting lots of extra attention too. And there are many online guidances about parenting in that situation. Your provider will give your baby a detailed exam today and each day that you're at the hospital. And after you go home, there are some follow-ups to expect. So you should expect a follow-up with your provider or mother-baby clinic at least 2 days after going home, and sometimes sooner if we have a weight loss or a bilirubin we're following, at 2 weeks of age and at 2 months of age. So if you remember the number 2, 2 days, 2 weeks, and 2 months. And last but not least, I'm going to try to use this little CPR baby to show you one of my favorite ways to hold a newborn baby. Because many people, especially first-time parents, get a little nervous about carrying their baby. So always carry the baby with their head supported because they don't have the strength to hold up their own head. And then this is the part I want to show you. So 4 fingers under their bum and 1 finger inside this leg. This is a very solid hold for you to not slip and drop or fumble your baby, all right? Never leave baby on the changing table or the couch unattended. Always have one hand on the baby. If you can't have one hand on the baby, make sure that all of the sides are up so that you can safely step away. Please, if you have questions about any of this information, write them down, share them with your nurse, share them with your provider. We wish you the best in health and care for your baby, and best wishes.